Hello my friends, it's Dr. Harem. I am periodontist and I am about to present a series of lecture on the dental sciences, starting with periodontology. Before I start, I would like to ask you to subscribe to my channel, HL Talent, to get more video on these subjects. So, in the previous lecture, we talked about the history and examination, and we just discussed the first entity under this title, which is presenting complaint or chief complaint. Today we are talking about the dental history. Actually, the dental history provides an indication of the patient's overall attitude to dental care. Lengthy intervals between the appointments and the visits to the dentist it's unlikely to happen. Also, the low priority of the patients toward the dental health, or the patient who is unlikely to appreciate and comply with the comprehensive periodontal care, is unlikely to happen also. So today I'll just put a few points to be took in consideration in the dental histories. So in dental history, a few points should be considered. First of all, the reason for previous loss of teeth should be established. Reason for previous teeth loss should be established. This is one of the most important things. And recent dental treatment. The information includes radiographs, any recent dental treatment, any previous one should include the radiograph. So this is the first point that should be considered during taking the dental history. The second one, which is another important criteria sometimes used to assess dental behavior, it's the frequency with which the patient brushes or claim to brush. The frequency and efficiency of brushing. Sometimes you may find a patient which is doing brushing 4 to 5 times daily, but when you come to the efficiency of the brushing, you find that this patient take a few seconds for brushing. And this is an important point to be considered during taking a dental history, because we need to change this behavior after that in motivation and instruction. So the efficiency is more important than the frequency. Actually, you should have 4 to 5 times, 4 to 5 minutes of a brushing daily, and 2 to 3 times frequency. So it should be taken in consideration, because sometimes the patient you need to change the patient's behavior during taking the dental history. And in particular, in young patients who undergone the orthodontic appliances, the extended period of fixed appliance, long periods of fixed appliance may cause a major problem for a patient, which is a crystal bone loss, crystal alveolar bone loss. During long period fixing appliances using, you may face crystal bone loss, partly from tooth movement, and partly from periodontal inflammation. These two causes may affect the whole periodontium of the patient. So you should take in consideration the orthodontic appliances, the uses of orthodontic appliances, and the time, the period that that the patient wear this appliance. We know that from the tooth movement we have a remodeling on one side and bone loss on the other sides, and also in periodontal inflammation we have a limited access to clean interproximally and subgingivally, so we have a crystal bone loss in young patients. Because of these two reasons, we may face crystal alveolar bone loss. And most important point of view in my opinion is that teeth that have been tipped during orthodontic appliances rather than bodily movement, those have a tipping movement, not bodily movement. We may find those of tipping movement. We may find a mesial and distal angular bone loss, which may mislead us during the diagnosis. Why? Because when you find in a young patient, especially in the incisor and molar areas, an angular bone loss on both sides of the teeth, you may think of localized aggressive periodontitis. So such topography gives the appearance of such a lesion. So you may be misled during the diagnosis. So these points in the dental history, I think it should be taken in consideration. Thank you for your listening and have a nice day.